Right. So this is all about the case notes, and we are going to start writing this letter. Right. Okay. So there we are, live on the Zoom, and whoever is available on Zoom, you can approach Zoom, and whoever is not on Zoom, you can go to YouTube video. The links are provided in the Telegram channel as well, so you can take from there. Right. So let me take my notes. Okay. Simon. Okay. Simon. Yeah. Fine. Okay. Right. Now let us see how we are going to deal with this case notes. Now, what is important and what is not important? What is important and what is not important? So there are 7 components. There are 7 components which are very, very important. So what are those 7 components? I'll tell you now. So those 7 components I will write in the rough page work. So here I will write. Here I write the 7 components. So these 7 components. Okay. Number 1, the 7 components. Okay. The OET, the 7 components of an OET letter. So number 1, the address. Number 2, the date. Number 3, the salutation. The salutation. Number 4, the subject line or the reference. And then the number 5, the body. Number 6, the closing remarks. Number 7, the sender's particulars. So these are the 7 components. So fine, that is it. These are the 7 components of an OET letter. So these are the 7 components of an OET letter. So note them down if you want. Edit. Oof. The 7 components of an OET letter. So write down one by one. Number one is the address. Number 2 is the date. Number 3 is the salutation. Number 4 is the reference. Number 5 is the body. Number 6 is the closing remarks. And number 7 is the sender's particulars. Yeah. So fine. So these are the 7 components. These are the 7 components. So write down these 7 components here. Okay. Edit. Take a snapshot. Yeah. I'm posting in the channel for your purpose. Okay, so that you will not miss anything. Okay. Now, where can we find this piece of information? Where can we find this piece of information? Now, yeah. So first one is the address. First one is the address. Address, to whom are we writing? Who is the patient? What is? First one is, you can see here, the address. So we are bothered about the address now. The address. So how are we going to write this address? Address you can label 5 parts. 5 parts. So I'm going to show you those 5 things now. Number 1 is Miss Georgine Ponsford. This is the first one. And second one is resident community nurse. That is the second one. Community retirement home. That is the third one. 103 Light Street is fourth one. And Newtown is the fifth one. So 5 components. So altogether, there are 5 components. These 5 components you have to see. These are called as 1. 1 is number 1. Number 1 is the address. Number 1 is the address. So what are the 5 components of the address? Let us take them here. The 5 components of the address. Okay. The 5 parts of the address. Let us take number 1. Number 1, okay, is the address. Okay, in the address we have 5 different things. 1.1. 1.1 is the name of the receiver. 1.2 is the name of the designation of the receiver, the designation. Okay. 1.3, the hospital, the name of the hospital. Okay. Or you can say the designation or the name of the designation. Right. All are names here. Next one, 1.4, the name of the street. 1.5, the name of the town or city. The name of the town or city. The name of the town or city. So 5 different things we have here. 5 different things. So these we are going to find out now. Those only we are going to write here. What are those 5 things? Let us see here. We are taking from here. Okay. Suppose, yeah. So this one. Okay, from here onwards. So you are writing a discharge letter to from here to here. Okay, I am taking one. Sorry. Okay, I'm taking that. And again going to setting. Yes, the 5 names are here now already. So that is Miss Georgian Ponsford. So remove comma, no need comma. Resident community. Okay, nurse. Enter. Community retirement home. I'm simply showing how easy it is. 103 Light Street, Newtown. Remove full stop. So this is the address. Miss Georgian Ponsford, Resident Community Center, Community Retirement Home, 103 Light Street and Newtown. That's all, nothing more than that. That's enough. So this is how you are going to write the address. Where did you get the addresses? From the writing task here. From here you got the address. Next one. So, very good. Next one. Next one, number 2, is the date. Number 2 is the date. Okay. So now we are bothered about the date. Okay. We are bothered about the date. Now date, where we will get the date? Discharge plan. Sorry. It is discharge date is here. Okay. Discharge date is 11 February 2019. And today's date is 11 February 2019. Here also is given. And here also it is given. So both the places it is given. Now you can see here. Okay. So anywhere else? Okay. This letter will accompany Mr. Ramamurthy back to the retirement home upon his discharge tomorrow. So tomorrow is the discharge date. So assume that today's date is 11 February 2000. Actually, they gave a mistake here. So discharge date is 11 February. So today's date is 10th February. So that's a mistake here in the official question paper. So that is very clear. Discharge date is 11 February and tomorrow he is getting discharged. Okay. Okay. Otherwise, discharge tomorrow he's telling. So discharge date is 11 February. You can see here. Discharge date is 11 February 2019. Discharge date is 11 February 2019. That's very clear. Okay. So focus on this point which I'm explaining you now. This is a confusion little. Okay. Discharge date is February 2019. Okay. Right. Understood. So if this discharge date is February 2019, and what the case notes is telling you in addition to this, it is telling you today's date. Today date is 11 February. No, this is wrong. Okay, in the case notes itself, it is wrong. Because today's date should be 11 February because he is scheduled to be discharged tomorrow. Discharged tomorrow. So here. Upon his discharge tomorrow. So tomorrow is the discharge. Discharge is tomorrow. So automatically today's date will be 10th February. Sorry. Okay, 10th. So be very careful. Discharge tomorrow. What do you mean by discharge tomorrow? So today you are writing the letter. Today you are writing the letter. And that is what it is. So you have to assume today's date as 10th February, right? So now today's date is 11th February. No, today's date is 10th February. By mistake it is. That's very clearly understood. So 11th, discharge is 11th, and therefore today's date will be, so discharge is 11th February, and that is tomorrow. So discharge tomorrow. So today's date is 10th February. So by default, this is a mistake. Okay, no problem, 10th February. So you have to write 10th February. That's it. You have to write 10th February. Let us see in the sample letter what they have given. There also a mistake is there, or okay. Yeah, 10th February. Yeah, they have given. So this is today's date. That is what it is. I am telling you. 10th February. 10th February. So I told you that is clear. So today's date is 10th February. Remember that. Okay. And we have already seen here. So Miss Georgian Ponsford, the first one I have already explained. Resident community nurse, the designation. Community retirement home, the facility. 103 Light Street, the name of the street. New Town, the name of the town. Name of the person. Okay, resident community, name of the designation. Community retirement home, name of the facility. 103 Light Street, name of the street. New Town, name of the town. That's all. Then you have got the address. Okay, fine. Next one will be salutation. Dear Miss Ponsford, from where will you get this first Miss? This is called title. Miss is called title. So you will take this Miss only. You will take this Miss and you will take this Ponsford, second name. Second name, these two. Okay, Miss Ponsford, don't write Georgine. You'll write, okay, Miss and Ponsford. So these two are very important. Dear Miss Ponsford, so that will go here. So you'll add dear here, and then first name, title, and then you will have Ponsford. Okay, you can write comma or you can leave it. That is not a problem at all. Dear Miss Ponsford. Dear Miss Ponsford. So this is how you have to write. So from where will you get that one, dear Miss Ponsford? From the second one. So date you got, and now you are going to have the salutation. Where will you get the salutation? Salutation also from the same writing task. Dear Miss, here. This is Miss, dear Miss, and Ponsford from here. Dear Miss Ponsford. Finished. These are the things you have to concentrate. So dear Miss Ponsford comes from the address line, first line. So title Miss and Ponsford second name. So dear, you have to add dear Miss Ponsford. That's all. So you understood from where you got these things. So next one, you will go to the regarding line. The regarding line. Where you will go for the regarding line? Go to the beginning. Go to the beginning here. So you are writing regarding Ramamurthy. So that is Mr. Lionel Ramamurthy. So he is 63, aged 63. Mr. Lionel Ramamurthy and aged 63. So you will write like that. Okay. So date of birth is given? No, date of birth is not given. So Mr. Lionel Ramamurthy. So how you are going to write this one here? So this is number 4. Address, then date, then salutation, then regarding line. Okay, now how are you going to write this regarding line? This regarding line will be like this. Okay. Regarding R capital, E small, colon, immediately, regarding colon, space. Once again, R capital, okay. Okay, R capital, only for showing you big, I'm doing like this, regarding R capital, E small, colon, then space. Now see again, R capital, E small, immediately, no space, immediately colon, then space. Many people put like this. colon space before. No, there should not be any space in between. So regarding, okay. So this is Mr. Lionel Ramamurthy. So Mr. Lionel Ramamurthy. Mr. Lionel Ramamurthy, comma, aged 63. So Lionel Ramamurthy, aged 63. So that is how it is. You have to write like this. Regarding Mr. Lionel Ramamurthy, aged 63. That is it. This is the regarding line. Fine. So these are the first four things we have already got now. So salutation we finished now. Salutation we finished. Then we got the reference or regarding line. So we have got all these four things. Now body we'll see later, and then we'll see the closing remarks. So we'll see the closing remarks. So where will you get these closing remarks? So closing remarks. How to get these closing remarks? Here itself. This is related to Mr. Ponsford. Are you writing to the person with a name? Are you writing to the person with a professional name? Are you writing to just a dear sir or madam? So that is depending. So if you are writing, if you know that the person's name is Miss Georgine Ponsford, then you will write like this. Okay. So this is closing remarks. Then you will write yours sincerely. Yours sincerely. So you will write yours sincerely. Okay, if you know the name of the person, receiver of the letter, you know the name of the person, that is Miss Georgine Ponsford. If you don't know the name of the person, then you will write yours faithfully. So you will write yours sincerely, or you will write yours faithfully. Yours sincerely, you will write when the name of the person is there. Miss Georgine Ponsford is there, then you will write yours sincerely. With or without a comma, no problem. Then you will write yours faithfully if Miss Georgine Ponsford is not there. Instead of that, the next line is there. A resident community nurse or charge nurse or ward nurse or doctor. Name of the doctor is not given. Just a doctor is given. Physiotherapist is given. Whatever name of the profession is given, you will use yours faithfully. And name of the person is given. For example, Simon Peter. So you are writing to Mr. Simon Peter, then you have to say yours sincerely. And if you are writing to a nurse, okay, without knowing the name, for example, ward nurse or resident community nurse or charge nurse or senior nurse or community nurse, whatever it is, or doctor or physiotherapist, whatever name is there, name of a profession, then you will write yours faithfully. And one more thing is also there, dear sir or dear madam. If you are writing to a doctor, you can say dear doctor. If you are writing to a manager, you can say dear manager. If you are writing to a supervisor, you say dear supervisor. If you don't know to whom you are writing, for example, community health center, you are writing. So dear sir, that's it. You don't know the name of the person. You don't know the name of the profession also. Then you have to say dear sir. Then also you have to write yours faithfully. Right. So this is the way how you are going to write here. Then okay. Then your address. Last, sender's particulars. Sender's particulars is here. 7th one. Sorry. Sender's particulars. Sender's particulars is here. When you see sender's particulars, okay. When you say sender's particulars, When you say sender's particulars, now you have to notice one thing. That is your particulars, who you are. Okay, using the information in the given case. So this is a discharge letter. So try to understand. This is a discharge letter. This is a discharge letter. Try to understand that this is a discharge. Even if it is not there, here you will get a discharge plan. So here it is there, discharge plan. So anywhere he may give you that this is a discharge letter indirectly. So write a discharge. If it doesn't give here also, here it is there, discharge plan. Remember that one. So next one, you are. So you are charge nurse. You are charge nurse in the medical ward. In the medical ward. And the name of the hospital is Newtown Public Hospital. And the street name is 41 Main Street. And the town name is Newtown. So you know all the 5 things are there. Many people write, you are sincerely nurse. Why? The address is given, then why are you not sending? Do you know that you are losing marks for this? You are losing marks for this. From where it has come also should be there. Why are you not writing this? Sir, we don't know. What you don't know? If you don't know, is it acceptable? You are walking on the ground. There is a pit. Okay? And you don't know that there is a pit and you are looking into your mobile and you are going walking. Then why did you fall down? I don't know that there is a pit. There is no use of any excuse. So now you see how many points are there here. 5 points are there. So very careful you have to be. We are careless. That's why you lose marks. Charge nurse. Then next one is medical ward. Next one is Newtown. Many people write Newtown Public Hospital. 41. If it is not important, then why did that fellow give this? Main Street. Is he mad? Newtown. So these are the 5 things that you have to write. And what you will do? Okay, your name is not given, so leave it. Charge nurse, medical ward, Newtown Public Hospital, 41 Main Street, Newtown. How did I get? Why did you not get this? Maybe you have written this letter. You don't even notice because you don't even have an idea. Somebody is teaching. Okay. There was one girl just now telling. Okay. I think I can call her. I can call her. Is she there or not? I don't know. Yeah, Bindu is here. Hello, Bindu. Can you unmute, please? Bindu, you have just now told me, right? Before coming to me, I did not even admit you. But before that, you asked me to join the class. I said, no, I'm busy. I'll talk to you later, right?
Yes, sir.
Are you the same Bindu?
Yes, sir. I am
so
here.
Now you understand what is happening to you.
Yes, sir.
So this is what many people don't know, because they are going to ordinary people and ordinary people are teaching something and they are going and writing something and they are coming with something. That something is nothing. Because that is not what is only expected. 350 marks out of 500. You only told you just now, Bindu, before coming to the session, just I was sending the link, you told me, you suddenly came to me, I don't know why you came to me, I don't know. You said somebody, my old student referred my name, you had a talk, that is different story. But what I'm telling you is, this is what everyone is missing. Many things we don't know that we have to do. So charge nurse, medical ward, Newtown Public Hospital, 41 Main Street, Newtown. Why are we not writing this? If it is not important, then why did he give us? Letter means letter. From address should be there, to address should be there. So everything is important. If you don't write, it is okay. I am also saying it is okay. It is okay. Okay means accepted. Accepted means no problem. No problem means average. Average means to 300 marks. It's okay. So be careful what you are doing there. Be careful what you are presenting there. How you are presenting there. What is important? Am I getting all the necessary information or not? This is required or not? Who told you should not write this? Sir, nobody told we should not write. Okay, who told you should not write this? Did anyone tell you? Okay, that's their problem if they don't write. But when you know something that it is important, it is better you write. So we have done with all the other components, 7 components. Address, date, salutation, reference, closing remarks, sender's particulars. We have done everything. Now we have go to body, the 5 parts of the body. So I will explain you the 5 body parts. Now, okay. Okay. I'm going to write here 5 body parts. Right. The body. This is the 5th component, the body. The body of the letter has again 5 subparts. Number 1, the introduction. Number 5, the conclusion. These are not very important, but still important. So 5 different things. The introduction and the conclusion. Between them are number 2. Number 2. Okay, BP1. Number 3, BP2. Number 4, BP3. Right. These are the right. The introduction, body part, paragraph 1, body paragraph 2, body paragraph 3, and the conclusion. Okay. Now we see how to follow the introduction and what is the conclusion. So introduction, body paragraph 1. First you'll write the introduction, then you'll write the body paragraph 1. Body paragraph 1. The most important problem. The most important problem for ordinary letters, the present visit for urgent letters. The most important problem for ordinary letters, the present visit for urgent letters. So urgent and ordinary, again bifurcated. Ordinary letters, write the most important problem, the most serious problem. Because problems are there, no urgency. So the most serious problem is there. The most serious problem is there. That one you have to write in the body paragraph 1 or urgent 1. Okay. The most serious or if it is urgent letter, the urgent visit. The urgent visit. So you can take any one thing here. So the primary or the most important. And then the next, the other serious problems. The other serious problems are okay. Or the ordinary visits or other visits. Okay, others. visits. Okay. Other visits. Then next one is the other background, social background, history, medical background, and other background, financial background, professional background, or the other areas. The other aspects, all the other things you can take. So that is what it is. So if it is the discharge letter, it should be discharge plan. So you'll write post discharge. So first paragraph will be on admission, discharge plan on admission, post operatively or during hospitalization. Then lastly, after a discharge. So after admission, after operation, after discharge. So these are the three stages, body paragraphs you can write. So first one, during admission, what is his condition? That is BP1, because this is a discharge letter. And second paragraph will be, so during admission to operation, then after operation, post-operatively or something like that, if it is operation, how he is recuperating, how he is improving, what is his status, what are the treatments provided, what are the services offered, all these things will come there. Then fourth paragraph, that is body paragraph 3, will be after discharge, what you have to do as a nurse. That is what you have to do. What the other person, the other nurse should do, or the other doctor should do, or the other physiotherapist should do, what they should do. That is body paragraph 3. So that is called differentiation. That is called differentiation. So now let me ask some students whether they have understood. Don't feel bad if I don't call everyone, because I cannot call everyone. Okay, I will call the serious students, the very serious students, and who are regular students and who are worried too much about writing, who have too much problem with writing. They have personally asked me. So that's why I will ask them. Okay, it's okay. Right. Now, Neha. Neha is the girl who joined only for writing. Okay, Neha, just for writing, she paid 5,000 and she's registered with me. Neha, can you tell me, did you get the required information? Did you get the information you required? Are you getting the support you require from me?
Yes, sir, I'm getting.
Yeah, after today's session, till now I was correcting your papers and I was explaining many things, but I think you got the gist of everything today, almost. Am I correct?
Yes, sir, exactly the body, how I should formulate. Now I get it.
Okay, now tell me, before this session or before attending my classes, how your situation was, and after attending my sessions, after getting my class, and after this lecture, how you are feeling?
Before attending your classes, how my writing was. Now I came 90%, I can say I have cleared all of my doubts regarding this letter writing, the sentence formation and the paragraphs. What are all the relevant information I have to keep in this body paragraphs and all.
Right, thank you, fine. So I'm muting you back. The next one is Reena Vinish. Hello, Reena Vinish. Did you get the relevant knowledge which you had expected?
Yes, sir. I have got the all these things. Whatever you thought, it was okay, sir. I was making correct, but when it come to body paragraph, like I was like totally confused what to do, what to write first, and what to write at the last.
So, did you get the clarification now, or still you have the doubt?
No. I got it.
Okay, thank you. Do you have any more questions or any more queries you want to ask me now? Because we are going into the body part now. Other than body part, we have cleared. We are entering into the body part. Are you okay for another half an hour session?
After the date, so like once after the address, date So after the date, should we put comma or how it is?
After the date, you mean date and month, in between date and month, or what exactly? No, comma
After
is
the
not
date, once after the
compulsory.
date.
Comma is not compulsory. I'll show you. I'll show you the sample letter you see here. Okay, where is comma here?
Okay.
So you can see here. Now, where is comma here? Is there any comma in the official OET paper? Just now I downloaded in front of your eyes, right?
Hmm.
Is there any comma anywhere? Can you check here if there is any comma?
No.
Many people say address next to first date. No need. See the official letter sample. Everywhere it is like this only. Okay. Everywhere it is like this. So Miss Georgia, so anywhere comma is there? No, comma is not important. Okay, 10 February 2009, comma is not important. But here comma is important. After Ramamurthy and age, here it is important. So right there. That's it. And then here you see, yours is sincerely. If you don't put comma also, no problem. Chargers, comma, no problem. Okay, it's not necessary. This is an average letter. Okay, this is not 100%. If you write this letter as it is, don't think that you'll get 500 out of 500. This is an average letter, easily accessible to everyone. Everyone can follow this letter. That's why they give it that style. If 500%, if a letter which is given for 500 marks is put there, no, many people will not understand. Okay, that is the problem. So that is why they will write in such a way that it will be something like 350 to 380 score, like that one they will put. Okay, so you have to improve on your own that area, those areas. Okay, right now. So right. So your doubts are cleared, right? Yes, Reena. So are your doubts cleared now?
Yes, it's clear.
Okay. Any more doubts left? You can ask me right now because I'm going to the next candidate. One more candidate I'll be asking. Okay, Hari
sir.
Priya.
No doubts.
Yeah, Hari Priya. Yeah, Hari Priya, I am giving you a chance to unmute. Where is Hari Priya? Yeah, here. Hari Priya, you can unmute, please.
Good evening, sir.
Good evening, Hari Priya. I did not call for good evening. You can straight away. Yeah, come on. Yeah, have you got?
I have one doubt, sir, regarding the salutation part. Where, when I can put the article the, for which cases, for which, like, designation I need to put.
Salutation, you are saying. Salutation is dear Miss Ponsford.
No, not salutation, the address part, the community health nurse, the doctor, when I need to put.
In the address. If you know that it is only one, then you have to put. Otherwise, not compulsory.
The orthopedician.
The orthopedician, if you know that it is only one person, the particular orthopedician, okay. After that, the name of the person is there, then you have to write the orthopedician, Mr. Simon Peter. Mr. Simon Peter is before, no need of the orthopedician. Mr. Simon Peter, orthopedician. But orthopedicians come forward, then the orthopedician, Mr. Simon Peter. You understand?
Still doubts, sir.
So Mr. Simon Peter is the person whom you are referring. So he is an orthopedician. That before the name of a person it comes, then you have to say the orthopedician, Mr. Simon Peter. Means that particular orthopedician by the name Mr. Simon Peter. Now you understand?
Okay, sir.
If orthopedician is before the name of the person, then you have to put the, okay?
Okay, sir. Okay.
Okay, right. Next. So this is how you are going to write these points. So one point I'm going to ask you, because we are moving forward to the next part, the final part, right? I'm going to give you various sentences. Okay. Right. So we have dealt so far with the parts, with the components other than the body. of the letter. Okay. Is that clear? So you can say yes or no. So we are moving to the next part of the third. If you have any doubts, so Kavita has said, sir, please repeat the body part 1. Okay, repeat the body part 1. Okay, we'll see that one. So I did not start the body part 1, paragraph 1. I did not start only. So I'm going to take now. I did not even start. Okay, right. So if you have understood, type yes. If you have not understood, type no. Right. So we have got almost 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 yeses. Okay, fine. Now we are moving to the body part. Now body part, how are we going to find the relevant information and irrelevant information? I am going to show you now. So what is relevant information and what is irrelevant information? So this is the body. Okay. Right. So the information, right. Now let us see here. So his residence is community nursing home. So his residence is community retirement home and he is going to community retirement home. So this is his address now, address of the community nurse. So this is a known case. This is a known case. He has come from community retirement home and then he's going there. So community retirement home. So his residence is community retirement home. So he came from there. Community retirement home in Newtown. He came from there and then, right? He is going there only. You are writing the letter to that person only, to the community nurse, resident community nurse at the community retirement home. So you can see here. So he is going to community retirement home only. So from there he came and to there only he is going. So he is going back to his residence. The residence is community retirement home in Newtown. 103 Light Street, and the person who was taking care of him only is going to take care of him now also. That means everything, the past history, she already knows. So don't tell everything. So how do you identify the back to your facility or back into your care or back to your facility? So you have to understand that thing there. Back to your facility, back into your care, back to your facility or back into your care. So discharged back into your care tomorrow. So discharged back into your facility tomorrow. So try to understand this. So these things will go into the body paragraph. These things will go into the body paragraphs. So what will go into the body paragraph? Let us see here. Let us see here what will go into the body paragraph. So discharge. Discharge is one word which will go into the introductory. So this is introduction. So we are writing the introduction now. Suppose in the introduction, what are the things that will go? So 5.1, that is the introduction, the body introduction. The body, 5.1 is the body, and then 1 is the introduction. So that is it. 5.1, that is the body, the introduction. Then you are going to write the discharge. This word will definitely go. Discharge. Tomorrow also will go. Tomorrow. Tomorrow is here. Discharge letter, so discharge. So tomorrow he will go. So being discharged tomorrow or will be discharged tomorrow. So tomorrow is future. So will be discharged tomorrow. So you can write. So will be. Okay. So will come forward. Will come here. Will be future. So future passive will be discharged. This is passive. Will be discharged. D. Will be discharged tomorrow. Will be discharged tomorrow. So that is it. And then will be discharged. Then one more thing is, so he is discharged back. He is discharged back to your care or into your facility. Back, okay, back into your facility or discharge back, okay, to your care. Okay, so discharge back into your facility or to your care. You can even say into your care. Okay, into your facility or into your care or to your care. So try to understand this one, how it is taken care of. So this is one point which we have seen. So it is a discharge letter. The next one, what more will come? So we have got this from here. Discharge tomorrow to the retirement home. Okay, to the retirement home. So he is telling you, but you are telling at the community center. Okay, right. Now this we will take forward. From here, you have to pick up some more information. You have to pick up some more information from here. So, Mr. Lionel Ramamurthy, a 63-year-old, is a patient in the medical ward of which you are charge nurse. So now this is the address, hospital address, your hospital address, right? Lionel Ramamurthy. So now here you have to write the name of the patient, Mr. Lionel Ramamurthy, write full name. Or even just Mr. Ramamurthy also you can write, because in the subject you have already written Mr. Lionel Ramamurthy. No need of writing full. Okay, even if you write Mr. Ramamurthy, it is okay. Or Mr. Lionel Ramamurthy is also okay. If you have some confusion, you can write, no problem. Mr. Lionel Ramamurthy. Right. Now this is one point which you have to write. So Mr. Lionel Ramamurthy you are taking from here. So from here you are taking Mr. Lionel Ramamurthy. And here is a diagnosis. These two words will come. So diagnosis past, happened, finished, already diagnosed. Already diagnosed. Diagnosed with pneumonia. Diagnosed with pneumonia. So that you are going to write here. Mr. Lionel Ramamurthy diagnosed with pneumonia. So here, right, diagnosis, diagnosed, past tense, diagnosed, then with pneumonia, 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 diagnosed with pneumonia. Okay, pneumonia. Diagnosed with pneumonia. Right. Now you see, Mr. Lionel Ramamurthy diagnosed with pneumonia. Okay, fine. That's very clear here. Okay. Now, admitted. He was admitted. So admission also is there, diagnosis also is there, recuperating also is there. All these things you can use anything, whichever you want. Okay. Right. So admitted with pneumonia. You can see. You can see here. So medical history 2007, medical background, admitted with pneumonia. So you can see here. Right. So 2007, 4th March, all these things are there. Then admitted with pneumonia. Right. So once again, we have to follow these things. Who is this person calling me? They know that I'm in the session. 1 second, please. Hello? Yes, are you in the session? I have already sent the link. You did not get the link?
Sir, I got the link. I need some session.
Yeah, I will definitely give you, but right now I'm in this lecture. Now, after the lecture, I'll talk to you, okay? Once I finish, immediately the first call will be for you, okay?
Okay.
Thank you. Okay, so admitted with pneumonia, right? So now good progress. So progress, good progress. That means recuperating. So you can say recuperating, recovering. So you can use diagnosed with pneumonia or admitted with the complaints of pneumonia. So you can say admitted with pneumonia or so you already see here, diagnosed with pneumonia, number 1, you can write. Admitted with pneumonia, you can write. Recuperating from pneumonia, you can write. 3 things you can write. Diagnosed with pneumonia, admitted with pneumonia, recuperating from pneumonia. So these 3 things you can write. So that's it. So those are the points which you can use. I'm giving you the sample letter here. Mr. Ramamurthy was admitted, contracted pneumonia. So was admitted with pneumonia, contracted pneumonia, okay, and diagnosed with pneumonia or recuperating from pneumonia. So anything you can write, that is not a problem. Okay. So you can write any one of these things. Okay, diagnosed with pneumonia, or admitted with pneumonia, or recuperating from pneumonia. Diagnosed or diagnosed or admitted. Okay. Right. Or recuperating from. Or recuperating from pneumonia. Okay. Okay, admitted with or recuperating from pneumonia. Okay, diagnosed with or admitted with or recuperating from or having contracted. Different style. There are 100 different ways you can write. But only the thing is you have to be careful with your grammar and other things. Pneumonia. Okay. Is being discharged back into. So Mr. Lionel Ramamurthy, comma. So you can make 3 sentences. Mr. Lionel Ramamurthy was diagnosed with pneumonia. He has been recuperating well, and then he is discharged. He will be discharged back into your facility tomorrow. Like that. So requires. Next one is requires. And why? What he requires? Requires. Okay, you can also say requires. Requires what? Requires what? This letter will, okay. retirement home upon his discharge tomorrow. What does he require? Okay. Monitoring. Needs help monitoring diet. Requires regular monitoring. Okay. And appropriate management. Paracetamol if necessary for chest abdomen management. Pain management. Body management. Food management. Nutrition management or diet management, whatever you want to say. So here you have got it. Monitoring, regular monitoring and appropriate management. So you can write that from there. Requires regular monitoring or ongoing monitoring. Okay. Monitoring and appropriate management. Managing his condition. Regarding many other things, physical activities, exercises, okay, dressing changes and many other things. So that is how you have to follow this. Okay. That is how you have to follow it up. So Mr. Lionel Ramamurthy, Mr. Lionel Ramamurthy, who was diagnosed with pneumonia, okay, or who was admitted with pneumonia, or who has been recuperating from pneumonia, so here will be a comma. Mr. Ramamurthy, then who, okay, who was diagnosed or who was admitted or who has been recuperating. Okay. So who admitted with or has been recuperating. Okay, this is how. Right. Okay, just bear with me 1 second. Okay, has been recuperating from, okay, requires, okay, regular monitoring and appropriate management. So here it is. Then will be discharged tomorrow. These are the points that will go into here. So Mr. Lionel Ramamurthy, who was diagnosed with pneumonia or who has been recuperating from pneumonia or who was admitted with pneumonia, okay, requires regular monitoring and appropriate management following his discharge back into your facility tomorrow. So however you want to write, different styles are there. You can write any style you want. Okay. Any style you want, you can write. So this is the introduction. I hope you understood the introduction. So the introduction, you can write in many different ways. Thank you for seeing. No need here because he's going back there. So no need of thank you for seeing. Okay, I am referring. No, this is not a referral letter. I am discharging. No need. I am. Don't write I. Okay. So the introduction. The introduction part completed. Is the concept clear? Yes or no? Come on, yes or no? Is the concept clear? Yes or no? Fast. I'll give just 20 seconds. I don't have time. Okay. I don't have time. Okay. If no answer is there, then better I close the session and go and do some other work. Okay. So if you can't give at least one word, yes or no, then what is the meaning of myself breaking my head here? For those people who are silent spectators. Okay. I don't want inactive stones and walls. I want active people, active brains. Okay. Right. Just I'm asking one yes and no. You can write whatever you want. Just one word. Right. So now we are moving forward. So to the second part. Second part. Okay. Second part. You will be writing. Okay. I don't want to take again explain everything already which is explained. I will take from that because I want to rush a little bit faster. Okay. So right. Now here this is the body part 2 paragraph 1. Body paragraph 1. So medical background and medical body paragraph 1. Medications. Medical background and medications body paragraph 1. Nursing management and progress body paragraph 2 and body paragraph 3. And then here body paragraph 2 assessment and body paragraph 3 discharge plan. Discharge plan will go into body paragraph 3 and the staples to be removed after discharge, that is body paragraph 3, and follow-up activities body paragraph 3. So now let us see here. This is the story. This is the story. The most important problem is osteoarthritis and hypertension. These two problems you have to discuss, and what are the medications he is taking for those things you have to discuss. So medical background you are writing here and the medications. Medical background and the medications. What is his medical background? Medical background means according to the, so this is normal discharge letter. This is a normal discharge letter. This is not an urgent referral. So normal discharge, the most serious problem you'll be discussing first. So the most serious problem is osteoarthritis and the next important problem is hypertension. Okay. Right. The most important problem is osteoarthritis. Try to understand. So it required hip replacement surgery. So it required hip replacement surgery. So in 2016, osteoarthritis requiring total hip replacement surgery. Now 1989, it was hypertension ongoing management. And now this is which year now? Yeah. 2018, September. 3rd September 2018, and this is 2016, so this is past. 2016 is past. So now you can understand the seriousness or the intensity of the problem. So now if you see that one, the letter will be written in 5 paragraphs. So 5 paragraphs you can see, 5 paragraphs you will be writing the letter in 5 paragraphs. Let us see here. So this is the introduction. This is body paragraph 1, 2. So paragraph number 1, paragraph number 2, paragraph number 3, paragraph number 4, and paragraph number 5. So 5 body paragraphs. So out of 5 body paragraphs, so first one is the introduction and last one is the conclusion. And in between there are 3 paragraphs. So first one is related to his problem. Okay, right? His problem. Then second paragraph, your post-operative recovery, then discharge plan. So first one is the medical condition. You will have to write about the medical condition. What is his medical condition when he was admitted? Okay, from then what all the problems he has and what all the other things he has done. Then next one, post-operative recovery. What was given during the recovery period. Then next one, post-discharge. First one is post-admission. Then next one is post-recovery, post-operative. This post-admission. First paragraph is post-admission. Then second paragraph is post-operative period, post-operation. Right? Next one. This is post-discharge. So 3 things are there here. 3 things are there here. So you have to understand. Okay. So now he underwent a total hip replacement. He underwent a total hip replacement, right? You can see that one. So now when, what, how? So now you see here, very carefully you see here. Okay, 2016, osteoarthritis requiring total hip replacement surgery. 1989, hypertension, okay, ongoing management. So these 2 things are going on now. The problem osteoarthritis is going on and hypertension is also going on. 1985, long before, Cole's fracture at Orif. Okay, fine. Leave that one now. So now for these things, these are the medications. These are the medications you are doing. Okay. Now let us see here. Reason for admission. Okay, 4th September 2018, left to total hip replacement. So now this is the point, another point has come. So first one is surgery. First one is diagnosed with pneumonia. Number 2. So this is which one? Gerald Baker. This is Gerald Baker. So try to find out the points here very clearly. Gerald Baker, right. So see, whatever the points are there, whichever the case is there, however it is there, take that one. So if it is the patient, so if it is the Gerald Baker, it is total hip replacement. You can write for that one, total hip replacement. So now, yes, Mr. Gerald Baker, so you can say, who underwent LF to total. So these are the 5 different points which you can write in the introduction part. 5 different parts, you can go for the introduction part. Okay. Now here, Mr. Lionel Ramamurthy. Okay. So if it is Mr. Lionel Ramamurthy, it is pneumonia. And if it is Gerald Baker, it is, yes, total hip replacement. So in this case, how you are going to write in this case? That is very important, right? So next. So you have to identify those things, and based on those things, you have to write the points. So now let us go to the next part of the letter. I'm going to show you these 5 different things regarding Lionel Ramamurthy. Now see here again, here also 5 parts. So 5 parts. I'll show you 2 other letters also, how every letter has 5 body parts. So this is the introduction. So now let us see here. This is the introduction. This is paragraph number 1. And this is paragraph number 2. And this is paragraph number 3. And this is paragraph number 4. Okay. And this is paragraph number 5. Okay. So 5 paragraphs, it is always wise to write 5 paragraphs. Don't write more than 5 paragraphs. So now let us see here. Right. Now, introduction, you write 1 paragraph. Okay. Right. Yeah. Now, osteoarthritis, past medical history, eyesight. So you can see these different things. Okay. You can see these different things. In this case, you can see these different points which I have shown you here. And now let us go to our this case. Right. I'm going to explain this. Now see here, in the Gerald Baker's case, osteoarthritis and hypertension, ongoing management. Osteoarthritis and hypertension. How are you going to deal with these things? Okay, different letters have different types of presentation. So I'm going to show you comparative study. That is the reason why I'm showing you comparative study. Right. Now let us see here. Now, osteoarthritis and hypertension. So now I'll take a writing page, new one, so that we can discuss the points here. So how to make the sentences? How to make the sentences? Right. Now, so I'm going to show you different sentence structures, how to make in the passive voice. Okay, I'm going to show you how to make the sentences, different sentences. For example, you have one sentence, osteoarthritis and hypertension. These are two things we have to write. This is also ongoing and this is also ongoing. Okay, now let us see. 2016 osteoarthritis and hypertension 1989. So these are the 2 points which we are going to take now. So those 2 points I have mentioned here. Those 2 points I have. Yes, you can write, Sinju. You can write. So now let us see here. Now, the name of the patient also. We'll take this special care, this special case notes. Gerald Baker. Okay, copy text. So let us take this patient only now. So Mr. Gerald Baker. So if Mr. Gerald Baker we are taking has had, okay, osteoarthritis. Okay, has had osteoarthritis. Number 1. And okay, first one is osteoarthritis. Okay, then next one, right. And hypertension. Okay, Mr. Gerald has had osteoarthritis and hypertension since 2016 and 1989 respectively. Now here order is important. Which one is first and which one is next, you have to see. Okay, which one is first and which one is next, you have to see. Hypertension from 1989 and osteoarthritis 2016. So which is there? Both are there here. So try to find out the order. So order is important. Osteoarthritis is first, hypertension is next. So that is why you use the word respectively. The first one, osteoarthritis in 2016, that is the first one. And hypertension, the second one, and 1981, the first problem, first date, second problem, second date. That is why you are using the word respectively. Respectively. Okay. So you can say, right? So this is how you are using the sentences. So Mr. Gerald Baker has had osteoarthritis and hypertension since 2016 and 1989 respectively. Fine. So you can take one sentence. I will give you some sentences. Remaining sentences you can write because I have already explained you. Remaining sentences you can write because I have already explained you those sentences. So one sentence I have given you. Next one. Right. Now, next point, I'll give you some sentences. Now you can see here, aspirin, medication. Medication, this one, aspirin we are taking now. So one sentence regarding this one. Okay, that is, we have taken the information there. Okay, this is one part. So second information, this is it. So aspirin 100 mg main. Aspirin 100 mg main. So try to understand this part. Aspirin 100 mg main recommenced post-operatively. So you can start this sentence using post-operatively. Direct. Post-operatively, comma, aspirin 100 mg daily, okay, was recommenced. No need to write he. Direct passive voice. Okay. Aspirin. He was recommenced on. No need. He was recommenced on. No need. Mr. Baker was recommenced on. We know that this patient is Mr. Baker only. Aspirin is important in this sentence to make aspirin the hero of this sentence. Aspirin is important in this sentence. So make aspirin the hero of this sentence. This is the hero. This is the king of this sentence. Aspirin 100 mg. This is the hero of the sentence. So let it be the hero. Don't bring a Baker who is already a superhero and bring and make him a zero. That means degrading the quality of Baker. Baker is the entire letter, he is there. So every sentence you need not put Baker, Baker, Baker like that. So post-operatively, Astri 100 mg daily. Main means every day, daytime, morning. Nocti means nocturnal, night time. Main means during daytime, so daily. Daily was recommenced. Okay. So 100 mg aspirin daily, post-operatively was recommenced. That's enough. This is one sentence. So how are you writing these sentences is very, very important. I'll take the other sentences. What are the other sentences? Let us see here. Okay. Now he has treatment. So here we have the treatment for hypertension. Here we have the treatment for hypertension, ongoing treatment. So ongoing treatment is this. Ongoing treatment for this. Okay. Ongoing treatment is there here. Okay. In addition to the ongoing treatment, in addition to the regular treatment, okay, in addition to his usual treatment. So you can say this one. Take this sentence. How you are writing this sentence. Okay. So this is a new one. So ongoing management. So how are you going to write? 1989 hypertension ongoing management. So ongoing. Usual treatment is going on. Usual treatment is going on. So you can say in addition to the regular. Don't use the same word ongoing. Treatment. Don't say management. So change the words. Instead of ongoing, you change the word to regular. So you made it regular. And management, you say treatment. So I think you understand how I am modifying. In addition to the regular treatment, comma, regular treatment for what? Regular treatment for hypertension. So that is it. For hypertension, keep it as it is because you cannot change hypertension. You cannot change the word hypertension. So keep it as it is. So in addition to the regular treatment for hypertension, like that you can use. Or in addition to the usual treatment, you can also say usual treatment. Or the common treatment or the ongoing treatment. If you don't know anything, write as it is, ongoing treatment. That is the last option. If you are helpless, you can write ongoing. Okay. So treatment in addition, if you don't know what is the other word treatment, then you write management. So that is your wish. In addition to the regular or usual or ongoing treatment, management for hypertension, comma, something is added there. What is added there? You have to see there. In addition to the regular treatment, okay, some other thing is added. What is the other thing added there? You have to see. Right. Anything else is there? So here the medications are given. See here. Okay. Ongoing medication. Something is given here. Aspirin 100 mg male recommends post-operatively that we have already taken here. Recommenced post-operative we have taken from here. And in addition to the ongoing treatment, okay, something is added here. What is added there? You see there. Okay. What is added there? So pain relief is added. What is the common treatment? That is, okay, already you can see here. There is some other medication, aspirin, Ramipril is there. So in addition to that one, this Panadine Forte is given. What is this Panadine Forte? It is pain relief. Okay, pain relief medication. Okay, pain relief medication, Panadine Forte. Okay, that is paracetamol and codeine together. Okay, 2 QID PRN. What do you mean by PRN? PRN means as required. 2 QID. So this is, you have to understand what are these meant for. So I am taking this one. This is in addition given. This is given in addition to the previous medication. Already existing. So you can also use the word already existing. So already existing also you can use. See? Okay. Or you can use a current. In addition to the current medications, usual medications, current medications. So you can use any word, whatever you want, you can use, but be careful when you're selecting the word. Okay. So next one, he requires Panadil Forte. So, comma. Okay. In addition to the regular treatment for hypertension, what is it he needs? He requires, okay, pain relief, Panadol. Okay. Whatever is given in the case notes, I will never give you because case notes, sorry, it will be in the active voice because many people cannot understand. Many people can, you may think, sir, even in the OET letters, it is given active voice, sir. Yes, he requires pain relief. Active voice. It is correct. It is right. It is okay to write he requires pain relief. But why should you write? That is my question. Because OET is telling you, use passive voice. Then why you are writing active voice? Why they are giving this one? It is okay. It is okay. So they are giving you. But still they are telling, I'll show you. Only 1 minute I'll show you because there may be some new students. So for them, sir, I'm showing you OET sample letter. And I said, he requires pain relief. He requires pain relief. Okay, this is active voice. Pain relief is required. This passive voice. Now, OET, official, passive voice, writing and speaking. So, do you know how to write passive forms correctly? Because passive forms are great for making the patient or treatment the focus of a sentence. Okay, I don't want to go into the depth of that one. This is enough for you. This is enough for you. Passive forms are great for making. See here, passive forms are great for making the patient or treatment the focus of a sentence. Using it during writing and speaking subtest can help you. That's it. That is enough for you. So why OET official www.occupationalenglishTester.org? Do you know? He's asking you, do you know? If you don't know, follow it. If you don't know, learn it. They are telling, occupational English test is telling, I'm not telling you. So they have given in the official sample letters, they have given. But if you write active voice, they are okay. Okay means accepted. They are correct. Nobody is telling they are wrong. But which is better? Which is better? See, you are wearing a dress to the office. Office is a formal building. Home is an informal building. What do you mean by formal and informal? Formal means you have to behave as you ought to behave. Informal means you can behave as you like. So the choice is yours. Formal means there is a form, there is a shape, there is an order, there are rules, there are regulations. So that means in the office, you should go in formal dress, not in informal dress. So if a person goes on shorts, okay, they will not be accepted in the office. In the same way, what is the best option? Okay, they can go there, but what is the situation there? So which is the best possible option? That is what OET is telling. So remaining things in your hands. Whether you like it or not, I have to tell the truth. So he requires pain relief. He requires pain relief. So I suggest you don't use that. It is better, you can use it. You can use it, no doubt. So in addition to the regular treatment for hypertension, so he requires, he means who? Baker. Baker, or he requires. This is correct only. There is no doubt regarding this. There is no doubt regarding this. Baker requires or he requires. There is no doubt regarding this. This is correct. But what I tell you is, instead of Baker requires, you can write Baker requires pain relief. Okay, so pain relief is required. Why don't you write like this simply? He remove requires from there and write here is required. Pain relief is required. You can write like that. Pain relief. He requires. Pain relief is required. Always. So, is required. Right. Pain relief is required. And what is this pain relief? Pain relief is Panadine Forte. So, pain relief. So you can write in brackets here, pain relief, Panadine Forte. Where is this Panadine Forte? Case notes, go to the case notes. So here, Panadine Forte. Panadine Forte. So that you are going to write. So Panadine Forte, copy. Okay. Pain relief, Panadine Forte is required. Panadine Forte. Pain relief is there. Panadine Forte in brackets you have got. Pain relief Panadine Forte is required. And then, so 2 QID. So 4 times a day, 2 tablets. 2 tablets 4 times a day. Quarter, every quarter. Quarter means what? What do you mean by quarter? 24 hours in a day. QID. Quarter in a day, for every quarter in a day. So quarter means 1/4 of day. D means day. Quarter means 1/4. 1/4 of a day. So you can say 6 4s are 24. 1 quarter. 24 divided by 4 is equal to 6. So every 6 hourly. Okay. So 4 times. 4 into 6. 4 times. So into 2. 8 tablets you are taking. Twice. Okay. 2 tablets 4 times a day. Or 2 tablets every 4 hourly. Okay. 2 tablets once every 4 hours, or maximum 8 tablets per day. However you want to write, you can write. So 2 tablets once every 6 hours. So you can write like that. So how are you managing these things is more important. Okay. So right. Panadine Forte. How many? So Panadine Forte. Pain relief, Panadine Forte. Okay. Comma. So 2 tablets once every 6 hours. Okay. Is required. Pain relief is required. Okay. Pain relief is required. Panadine Forte 2 tablets once every 6 hours. Okay. Maximum. Okay. As required. PRN. Means whenever required, or however, whatever it is there, PRN. What do you mean by PRN? So try to see that word and you have to learn those words. Now let us see. You can just type the word here in the Google and you say PRN. Prorinata. PRN means prorinata. So PRN. So PRN, this is what it is. PRN means in medical terms. PRN means prorinata. So PRN means prorinata in the circumstances, in the given circumstances, as the circumstances means as necessary. Okay. So you can say prorinata. So prorinata you can see in Wikipedia also or wherever it is. So as the as required, whenever required, according to the required circumstances, in the circumstances, in the relevant circumstances, in the prevailing situations. However you want to write, change the PRN, don't write PRN, change whenever necessary, you can write. According to the situation, you can write. Whenever necessary, you can write. So this is how you are going to use it. So next, as required or whenever required, you can say. So now next one, that is the one sentence. Next, we will take another sentence. So we'll learn 5 or 6 sentences like that, and you can use your own. You can write your own sentences. You can write your letter and you can submit. So I'm teaching you the Gerald Baker one. So now next one you can see daily. This is B2. Daily dressing, surgery, incision site. Daily dressing, surgery, incision site. Daily dressings, surgery, incision site. So this we are going to take. Copy text. So daily dressing changes are required. So now how are you going to say daily dressing changes? Okay. So here daily, that means you can say regular daily dressing changes or require regular daily dressing changes on the surgery incision site are required for. Why it is required? Regular daily dressing changes on the surgery incision site. Okay, I'll increase the size. Okay. Are required for what? They are required for what? Then you have to go to another place. Are required for what? So here it will be. Are required for preserving skin integrity. Preserving skin integrity. So this is preserving skin integrity. So this is it. So you have to relate the information. You have to relate the information. This information and that information. So for preserving the skin integrity. To make it strong. So full stop. Regular daily dressing changes on the surgery incision site are required for preserving the skin integrity. See how I made the sentence. So this is it. Preserve skin integrity. I have taken those two and I have put here. So now you got the things. Regular daily dressing changes on the surgery incision site are required for preserving the skin integrity. So where there are two different parts. There is a bit of information and here is one bit of information. These two bits of information, you can take them together and you can practice. You can make the sentence. So now let us see here. Regular daily dressing changes on the surgery incision site are required. Sorry, not continue exercise plan. Sorry. So are required. So regular daily dressing changes on the surgery incision site. So these 3 points. Regular daily dressing changes are required on the surgery incision site are required for preserving the skin integrity. So this is how you are making these 3 points together and making a sentence. Create your own sentence. Okay. So now what I'll do is I'll take this one and make a style. So for preserving the skin integrity, comma. This is also correct. This is advanced style. You'll get more marks if you write different style. Special style. For preserving the skin integrity. That is more important. For preserving the skin integrity, this should be done. Okay. Regular daily dressing changes on the surgery site are required. For preserving, this for is preserving the skin integrity is minimized. The value is minimized if it goes into the end of the sentence. You have to bring it to the front of the sentence. For preserving the skin integrity, regular daily dressing changes on the surgical incision site are required. So, which is more important? Preserving skin integrity is more important. So, you have to bring that to the forefront. It is the face of this sentence. It is the most important part of the sentence. So it should be brought forward. I hope you understood how to write the sentences. Okay. I don't know how you are going to take. I have to tell. I have to explain. You have paid me for explaining all these things. So I am explaining these things. So it is better. You have to learn these things. That's it. There is no other excuse. There is no other excuse. There is no other excuse. Rather, only study. That's it. So how to write? I have taught you already how to write passive sentences. Now I'm showing you how to write quality sentences. That is what I'm saying. Quality sentences. Sentences of excellent quality. Okay. Is that clear? So you can write the answer yes or no. To some extent, at least you understood the importance of the sentences. Write down. Choose your answer, yes or no. First, 15 seconds I am giving you. 15 seconds I am giving you. If you say yes, then it's okay. If you say no, ask me why you did not understand so that I can explain you another session tomorrow. If you say no, then if you don't understand the importance, then I will explain you tomorrow again. You're taking a different case notes. Okay. So I'll explain everything. So those who are interested, okay. So then regular sessions you can attend. Every day I'm taking one writing session from now onwards today. So today, tomorrow, day after 4 days, 4 sessions continuously I'll be taking. So every day you have to attend the sessions. Okay, fine. So no, I'm attending the sessions just now. Okay, fine. Right. So, okay. Do you need these sessions? Do you need these sessions? Then you say yes. Then write down first. Just 15 seconds. Do you need these sessions? If you need these sessions, say yes. Otherwise, why should I waste this time explaining all these things to you? From tomorrow onwards, I will not explain the other body parts. I will explain only the body. Non-other body parts I will not explain. Okay. So, so tomorrow I'll take another lesson. Tomorrow I'll take the other case notes, that is second letter. Second letter. Today I have explained you Gerald Baker. Today I explained you Gerald Baker only. So other parts I have explained. That is different thing. How you have to write, you write. Whatever you want to write, you write. Okay. Other body parts, anything is the same. So tomorrow I'll take another one. Okay. Now I am asking you. Straight away you tell me. Because many people said, sir, you are teaching us too much. So it is just wasting our time. Okay. Are these waste of are these sessions? Okay, 1 second. Are these sessions a waste of time for you? Are these sessions a waste of time for you? Say yes or say no. Be careful while answering this. No problem for me. If you say yes, also it's okay. If you say no, also it's okay. For me, no problem. So if you say they are a waste of time, please don't come and waste your time. Please never attend my sessions if you feel that it's a waste of time. If they are useful, then you come and you attend. So now the last question is, because there are some students who don't want to attend the sessions, they want fast food. Okay, because they are busy. 8 hours they are doing duty, then 3 hours they are cooking, then 2 hours they are taking care of their children and a lot of things, and sleeping time. After that, they don't have time, so they have only 1 hour and they don't want to waste their time. Yes, practically, I salute you people. You are great. Huh? You are great to see great hope. Okay, that is Amir Khan's dialogue, to see great hope. Okay, you are great because you don't have time. Even though God has given you 24 hours of time, you don't have time. You are great. You need 48 hours and we cannot help you. So, are So next question, last question is, are you interested to attend tomorrow's, this is for all the regular students, tomorrow's session, because tomorrow's session is only for the regular students. Okay. Are you interested to attend tomorrow's session? So yes or no. So just say yes or no. If you're interested to say yes or no, then I'll fix a time and I'll be calling you. Okay. And every day I'll take a new case notes, and tomorrow we'll not go into address, date, salutation, regarding line, closing remarks, and sender's address. We'll only concentrate on the body of the letter. Okay. Then, those who are not regular students, for example, Bindu, you are actually wanting to join the sessions. Okay, so you can contact me later. I cannot talk to you because this is a session. I cannot talk to you. You can contact me personally. Okay, so if you are interested to attend the session, okay, tomorrow, because today, just for your sake, I gave it open, because I am giving you open. So I gave it open for everyone. If you are interested, then you can contact me. Okay, right. So fine. And then, so thanks for making this session a success. So you can write this letter, or you can write any letter like that. You can write this letter only, no problem. Okay, you can write this letter, Gerald Baker. I'll send you the case notes, Gerald Baker. The same thing I'll send you. Okay, I'll post this one only. Wait, and this is okay. The 5 pages with all ticks and marks, everything is there. I have given you this one. I'll put it there. Nursing sample task 101. Okay. Okay. Writing nurses. Yeah, this is the thing which I have for you. So I'll send this one along with the sample letter also. So this is it. I'll put it in the Telegram channel. Okay. In the Telegram channel, I have put it there. This is the priority based selection criteria. Okay, for relevant information. So I have already selected and I have given you there. You can take it. The case notes is there. You can write the letter and you can submit the letter, and I'll correct your letter. So this letter I'll correct. And I told the regular students, you can write 3 letters today, 3 letters, and send them to me. I'll correct 3 letters. Okay, right. So this is task 1. Okay, task 1. So Gerald Baker. Okay, Gerald Baker. So 5 letters I am going to show you now. 5 letters. So this is Gerald Baker letter. So many letters I have already corrected. You can see. So hundreds, thousands of letters I have corrected. See here. Thousands of letters I have. 3,261. 3,400 latest letter. 3,400. Okay, I did not post them till. So the letters are corrected. This is 3,393. 400 crossed already. So all the letters are posted here. So you can see, and you can go through these letter corrections. These are the regular students. Every day submit your timetable like this, so that you will be called regular basis for speaking and other sessions. If you don't submit, you will not be called. So this is Gerald Baker. Okay. See how many letters I have corrected for Gerald Baker. You can see. Okay. So, okay, fine. Samantha Bruin. Yeah, these are corrected letters. Okay. So case notes. Gerald Baker. Case notes. Okay. If you just write like this, you'll get the case notes of Gerald Baker. So Gerald Baker case notes. So this is the case notes. Here, this is the case notes. You can see here. This is the Gerald Baker case notes. Original case notes. I'm sending you back into the Telegram channel. So this is, I'm giving you 5 letters. Whichever letters you want, you can take. This is letter number 1. This is, okay, forward. So this letter you can write. Okay, second letter. Second letter is which one? Okay. Or what I'll do is, one more thing I can do. Official. I'll give you 5 letters. You can write all these 5 letters, official letters, once again in a pattern. So improvement after corrections, improvements. Okay. So OET, official writing. Okay, task. Okay. Sample test 1 writing. So just we'll take this one. Dentistry, dietetics, medicine. Okay. So copy link address. Okay. So copy link address directly the address I am posting here. So you'll get the case notes here itself. The case notes is got here only. Okay. So delete this message. That is first one. Okay. Right. This is the first notes. You can download from there. Then second case notes. Okay. So writing task 2. Writing task 2. Writing task 2 is here. Medicine, writing task 2. Nursing, writing task 2. Writing task 2. So this is medicine, writing task 2. So pharmacy, physiotherapy, nursing, copy link address. This is task 2. So task 2 question. Already this is question 1, question 2. 2 questions I gave already. Then task 3. Task 3. So here it is. Task 3. So all the letters I am putting here with the sample letters. Dentistry, dietetics, medicine, nursing. So nursing sample test 3. Okay. Copy link address. So this is sample test 3. Okay, nursing sample 3, sample 2, sample 1. Next, writing task 4. Yeah, writing task 4. So sample test 4, dentistry, dietetics, medicine, nursing. So sample test 4 is here. Okay, copy link address. Okay, test 4. The Telegram channel I have posted. Okay, you can collect it from there. So this is test 4. Then next one is test 5. So here is sample test 5 nursing. Copy link address. Test 5. 5 tests I have given here. 5 tests. So 5 tests. So see here, this is test number 1. This is test number 2. This is test number 3. This is test number 4. And this is test number 5. 5 tests. Okay. Regular, students. Okay, registered regular students, not regular students, registered regular students. Okay, can okay, regular students. So please please answer all the above 5 official sample questions and submit your responses personally to me as soon as possible for qualitative, so quality check feedback. Yes, that is for you. So I hope you understand everything. So that's very clear, right? Take care. Bye bye. Good night. Thanks for attending this session. Thanks for attending this session. Select all. Okay. Yes, bye. And who are there? Diana, Jacinta, Dimosase, Pachivola, Radhakrishna. Okay, good students.